Un placer. ¿Se va a levantar?
Se viene la silla.
Ok, vamos.
6 years ago, we decided that we needed to care for our frail elderly in a different way. We decided to have a separate space and dedicated staff to address the needs of this patient population. My name is Dr. Manuel Vazquez. I'm an internist. I've been here for 15 years at Urban Health Plan. I am the medical director in charge of the home visiting program. We take care of frail elderly patients. These are patients that are dependent on activities of daily living, that have multiple chronic medical conditions, and need caregivers, right? They somehow depend on somebody else for some of their activities of daily living. But as time goes by, patients get worse and their medical conditions, and now they're more dependent, and they can become homebound. And so they can no longer come to the clinic, or it's harder for them to come to the clinic. We actually started planning this in 2019. It was supposed to start in 2020, but of course, because of the pandemic, we had to take a step back, and we started the program on May 2020. Was our first home visit. So it took us a while, right? We had to figure things out with COVID. Patients were really isolated, were very sick, and they hadn't had a physical visit to the health center. And so that's when we said, no, let's start this and let's get on with the program.
La que yo tenía que no quería que me la quitaran, yo no sé por qué.
¿La que venía los fines de semana?
Sí.
Ok.
Tuvo mucho tiempo conmigo.
Vamos a averiguar. Nosotros llamamos a la agencia entonces.
We really do a lot of case management ourselves. It takes a lot of people. It's a huge team effort.
How many patients we have each day?
Wednesday we have 7, right? Thursday we have 5. Saturday we have 20 flu shots scheduled.
So far we've 2 nurses. One nurse has helped us a lot with the vaccines at home. The other nurse is in charge of all the logistics of the referrals for the patient referrals that we get, making sure they meet the criteria. Then we also have a medical assistant. He comes to us with to the visits, and he's also a patient navigator. So we try to do everything for our patients. So he coordinates transportation as needed, referrals, he follows up with the patient.
But the referral's in there,
Okay.
the contact information's there.
Perfect.
And then I put in the Dr. Rios note and the Dr. Deutsch
A
notes
common
as well.
theme, a common thread among these patients is loneliness, right? And so being there, right, for and going to this sacred place, which is home, right? It means a lot for them. The patient that we saw today, she lives in a 4th floor walkup, right? And she has severe arthritis. She can no longer go up and down the stairs. So for her, it's definitely an undue burden. She hasn't been out of the apartment in 3 years. The last time I saw her was in 2019. And so the benefit for them, the immediate benefit is that they are being evaluated by providers, right, by the clinical providers, and they are getting the service that they weren't getting before. Urban Health Plan, as a federally qualified health center, we are committed to serving underserved populations, right? And that also means meeting with the patients where they're at. So it's not only having the physical place, right, but also meeting them at where they're at. And if they're at home, and they can come to the clinic, right, that's also part of that mission, right, that we have to make sure that they get excellent services wherever they are.